As we push through these colder months, with the ever-changing weather comes the inevitable colds, flu, and that blah feeling that can hit us all. These months can be particularly tough time for staying healthy. But fear not, we have an expert here to help us out. We're delighted to welcome Dr. Gary Ishkanian, a distinguished internist and medical director at Montefiore Mount Vernon Hospital, who will share his invaluable insight on how to navigate these challenging seasons and maintain our vitality.
My name is Gary Ishkanian. I'm the Chief Medical Officer, Medical Director here at Montefiore Mount Vernon. I'm trained as an internist. I'm a board-certified internist. As an internist, I'm a physician for adults, and I welcome you here today to Montefiore Mount Vernon Hospital. I've held many roles here over the years. I'm currently the Medical Director, which is more of an administrative role. I've had a private practice in the city of Mount Vernon for years. I've been involved with teaching of medical residents and medical students. I've done research. So I've really had a role in many different aspects of the field of medicine. Currently, I am more administrative in this role.
And Mount Vernon here, the Montefiore campus in Mount Vernon, can you talk a little bit about where we are now? Because I know at one point we were unsure if Mount Vernon would still have a hospital.
Yes.
But here we are.
Yes.
Can you just give us an overview of that?
Sure. So Mount Vernon Hospital became part of the Montefiore Health System November 6th of 2013. Prior to that, we were part of the Sound Shore Health System, and we've gone through various transformations since that time. Currently, we're at a very exciting time for this hospital. We have a lot of initiatives over the next 3 to 5 years. We have a brand new master plan where we're going to have a new emergency room, new operating rooms, a transformation of our family health and wellness center, which is contiguous to the hospital. And one of the keys is re-engaging the community in terms of letting others know who we are, and what we're able to do both now and in the near future.
Oh, thank you for that. That was so informative. Now, we're looking forward to your insights and advice, Doctor. Now, the first one, and I think everyone would love to hear the answer to this, what is one of the most common illness that you're seeing right now during these winter months?
Sure. Well, the biggest one that we hear about every day is influenza or flu. I mean, we're seeing so many cases of flu presenting to our emergency room, and the community physicians are seeing that as well. And it can be quite a serious illness depending on one's underlying medical conditions. So, it's very important to know what some of the symptoms are and to know when to get evaluated and to get checked out, either by your own provider or in the emergency room setting.
And what are some of the symptoms that one could look for? Because we know we have influenza, we have RSV,
Mm-hmm.
we still have COVID. What are some of the common symptoms with the flu?
Sure. Well, unfortunately, many of these, the illnesses that you represented, there are symptoms which overlap. So one can have a fever, one can have malaise, body aches, sore throat, nausea, vomiting, and the list goes on. And many times it's difficult to discern which is which. So that's why it's important to get evaluated. Usually, we've all suffered from common colds, viruses, but the flu is much worse than that. People feel blah, they feel malaise, they feel muscle aches. So it's usually a more severe form of certainly of a cold. So it is important to get evaluated and get checked out if you're suffering from these symptoms.
With that said, What can our residents do to protect themselves from these common illnesses during the winter months?
Sure. Well, fortunately for influenza or flu, there is a vaccine. It comes out annually, usually in September, and it's highly recommended that everyone gets this flu vaccine, unless there's a particular contraindication for it. One of the fallacies is that people sometimes think they could get the flu from the flu vaccine, and that's not the case. The flu vaccine is an inactivated vaccine. You cannot get the flu. It might make one more susceptible for a few days to maybe pick up a cold or something, but it normally takes about 2 to 3 weeks to start to get that immunity in your system. So that's why it's important to try and get that flu vaccine when it's first introduced into the community.
Okay. Now, with this time of year especially, you have people who have chronic illness. Right? And they're not getting out as much as they would in the warmer months.
Yeah.
What advice do you have for those that are struggling with chronic illness and how they can stay safe during this time?
Just to go back for a minute, though, to the flu vaccine, and we spoke about how to best prevent and all. It's also important to things that we hear and read about every day: maintain a healthy diet, try and get adequate exercise, plenty of rest, plenty of hydration. I mean, these are things that go kind of across the spectrum of many different illnesses, and they are known to help in those situations. In terms of chronic illnesses, that's where it's very important to have that connection with your provider, whether it's your primary care doctor, your internist, your family doctor, whichever setting one gets their health care in, because it's important to have that conversation with them so that they could also make recommendations in terms of what one might need, whether it's a particular vaccine. There are vaccines, we mentioned vaccines for flu, there are vaccines for RSV, another type of virus that we spoke about, respiratory syncytial virus. The COVID vaccine is available as well. But again, that's where it's important to have that communication with your provider to say, am I eligible? Am I someone who should be getting the updated vaccine to try and prevent some of these things? It's challenging with chronic illnesses, especially this time of the year. People, as you said correctly, people tend to be more inside. They're coming off the holiday high of Thanksgiving and all the December holidays, and the weather might not be as conducive, or it might not be as sunny as it normally is. And it's challenging. It could lead to some kind of blah days, which everyone goes through at some point. But like I said, you want to make sure that you're up to date on your vaccines. You want to make sure that you're treating your chronic illnesses. You're taking all of your medications, and then the hope is that by doing those things, you will not have to end up in an emergency room setting where you would need further treatment and possibly admission into a hospital.
And I'm going to I just picked up on something that you said, feeling blah. Now, we know people get the winter blues. That's something that we've seen across the board over the years.
Yeah.
How would one, navigate that, or is there any advice on how to prevent or lessen the winter blues that we all seem to go through?
Well, that's challenging. I mean, I think the key is, fortunately, many people coming out of the holidays are able to be with family and friends and have that social interaction, which is so important. And if there's a way for that to continue during those winter days and months, the blah days, I think that would certainly help. Unfortunately, there's not a pill to take for the short-term winter blues. What we hope is that it doesn't progress into something like a seasonal affective disorder or SAD, because if that continues, the question comes up, is it more than just a seasonal affective disorder? Is there maybe an underlying depression? Is there some other kind of mental health disorder that has to be addressed and treated? So, unfortunately, there's not just one correct answer there. So,
thank you for that. Now, there are some serious illnesses. We spoke about a few of them before: COVID, RSV, and other serious illnesses. that people experience during these winter months. Are there any signs that they should be looking for that could tell them that if it's not just a simple flu, cold or flu, but something more serious?
Well, as I said earlier, everyone knows their body the best.
Right.
If they really start to feel unwell, if they're having a fever which doesn't go away, if they're having persistent nausea, vomiting, diarrhea, some other kind of gastrointestinal symptom, and they have chronic conditions, that's really when it's time to touch base with their provider or present to an emergency room. We don't like to use the emergency room for every setting, but there are just some times that, there's no alternative because things could be done there that cannot be done in maybe another setting. So depending on what one's symptoms are, if they have those symptoms that are ongoing, then it would be time to certainly get it evaluated to make sure it's not anything more serious.
And now we come to the two things that most people, a lot of people don't seem to get this right? The signs of a stroke, signs of a heart attack. We know that the signs of a heart attack is different with women. Now, can you just, we'll take stroke first of all.
Sure.
Can you give our residents some of the things that they should be looking for, and also the time frame, if you can, in getting to the hospital, getting help? Would you be able to give them some advice on what to do?
Sure. So pertaining to stroke or what we call cerebrovascular accidents or CVAs, there is a mnemonic or an acronym that we use that we try and educate everyone, both in the hospital setting and the community, and that's called BEFAST, B-E-F-A-S-T, BEFAST, meaning each of those letters stand for something for someone to be aware of, but the thought is that also if one is experiencing those symptoms, to get it addressed quickly or in a fast manner. So the B stands for, I'll mention what each of the letters are and then I'll explain them a little bit. So the B stands for balance, the E stands for the eyes, F is for the face, A is for arms, S is for speech, and T is for timing of things to happen. So of course, not everyone who has abnormalities with balance or their eyes or their arms or their speech or their face is having a stroke, but it's really to make people attuned to what those symptoms are, because if something happens and it's not getting better, and as I said earlier, everyone knows their body. So if someone is feeling something and they say, what, something doesn't feel right, or if they're with somebody, a family member, they're in a community setting, they're in a house of worship, any of these places, or supermarket, anywhere, and people start to feel unwell, it's important for both that individual and those around to understand that something more serious might be going on. So if someone balance is off and they're not able to stand properly, or if their eyes are blurred, or there's a drooping or abnormality of one of the eyes, or with the face, if there's asymmetry of the face and there's maybe a sagging or drooping of one side of the face, or with the arms. Everyone has a dominant side, but maybe if something new develops and someone is feeling a new weakness or a paralysis, or they're feeling pins and needle sensation, that could be indicative of something more serious. And then with the S of speech, it's usually maybe a slurred speech, or maybe they're not comprehending. So you can be talking to somebody and they're not understanding, what it is you're saying, and it could be something very basic, or they can't get the words out. So that could be indicative of something going on in the brain, depending on which area of the brain is affected. It leads to different situations. And then with the timing of it, it's always better. We say time is brain. So the quicker one gets to an emergency room setting, if they think, or if their family member, or if their friends or community people think that they might be having a stroke, it's better to get there sooner rather than later, because there are treatments, for these things. We at Montefiore Mount Vernon, we are a designated primary stroke center. So we are able to treat patients who come to our emergency room for strokes. If they need a higher level of care, if they have maybe bleeding into the brain or something like that, this is where we're fortunate to be part of an academic medical center in Montefiore, because we can transfer patients to the Bronx and they could get that level of care which we don't, we're not delivering here in Mount Vernon. So that's certainly important. When we talk about heart attacks or myocardial infarctions is the medical term for it, you're right, there are different ways that they present as well. I mean, the classic textbook is a heaviness in the center of your chest. I mean, in medical school, they used to say an elephant sitting on your chest or a heavy weight sitting on your chest. I don't think I'd want an elephant sitting on my chest, but even a baby elephant. But these are some of the things. So if someone is having pain in the center of their chest, or they're having numbness and tingling in their arms, usually the left arm, or jaw pain, neck pain, they're breaking out in a cold sweat, they're having nausea, vomiting, these could be indicative. Again, not everything is textbook, cookbook, not everybody is going to be having a heart attack. In women, it presents a little differently. It could be more nausea or gastrointestinal, abdominal discomfort. But again, you don't know. So the better situation is to get it evaluated, because if it does turn out to be a heart attack, again, there are treatments for it, and you want to get to those treatments sooner rather than later. We can do certain things here. There are medications, clot-busting drugs, things like that, which we could administer here. But again, if they need a higher level of care, this is where it's an advantage to be part of Maine Montefiore Medical Center, because we could quickly transfer patients to get the appropriate level of care which they would need.
Wow, that's a lot of information. Thank you so much for that.
Sure.
I think, our residents will appreciate that, because I think sometimes we misunderstand or we miss the mark when it comes to getting to the hospital in time. I think some people tend to call other people like, hey, I'm not feeling this way, should I go?
Right.
And you're saying the best advice is to go.
Yes.
To just get up and go.
There's no doubt about that. The worst case scenario is you end up going to an emergency room, maybe you end up waiting there. But if you present with possible stroke symptoms or heart attack symptoms, you're not going to be waiting in the waiting room. You're going to be quickly triaged, taken into the evaluation room, and have the appropriate tests done. And if the situation is ruled out and everything is fine, you're going to be discharged. And if it's not, there are going to be recommendations made for you to follow up with your primary care doctor, family doctor, the health and wellness center. These are things which we do here every day. But the key is, don't ignore it. Men tend to be more stubborn than women. They tend to ignore their symptoms. It's not good to be that way. It's always better, to be on the side of cautiousness and to make sure that you're not having that serious event.
Well, thank you. We've gone over a lot of things today. Is there anything that you would like to advise our residents on that I did not ask you? Do you have anything else that you would like to talk about?
There's a lot more I can talk about, and hopefully we will in the near future. But I think the key for the community is, in terms of our hospital, well, I think the takeaway message for the community is that we are open for business. I think they would be happy with the care that they received here at Montefiore Mount Vernon. This is where it's important to be part of an academic medical center, because if there's a need for a service which we can't provide here, that we would be able to refer them to the appropriate specialists at Montefiore Medical Center, and we would be able to connect them and their families with the appropriate individuals. If this hospital is needed for one reason or another, they would be happy with the care that they receive here.